Thank you very much. My question is to the Premier. With more people being infected by COVID-19, this government's actions are weeks late, incomplete and contradictory. They are scrambling. They are chasing the second wave instead of being in front of it with a clear and cohesive plan. Last week, the Ford government had to scramble to ration COVID-19 testing just a day after the Premier announced the scheme for asymptomatic testing. Then the Ford government had to scramble with new closing times for bars and restaurants. 4 months after Toronto Mayor John Tory and Toronto Public Health called for that to happen, 4 months late. When COVID-19 is moving so rapidly, why is the Ford government moving so slowly?
The Deputy Premier and Minister of Health.
Thank you, Speaker. Well, I would say that while the increase in COVID-19 cases is very unfortunate, it's also not unexpected. We have prepared for this throughout the summer months. We knew that we were going to see an increase in cases. We know we're facing flu season as well, and we're trying to keep the number of scheduled surgeries and procedures also on track. That is why we developed our comprehensive plan, Keeping Ontarians Safe, preparing for future waves of COVID-19. And it is a 6-pillar plan that comprehensively deals with the issue. First of all, maintaining public health measures. Secondly, implementing the largest flu immunization campaign in Ontario's history. Third, quickly identifying, managing and preventing outbreaks of COVID-19. Accelerating efforts to reduce health service backlogs. Preparing for surges in COVID-19 cases. And of course, dealing with the health human resources that we need in order to keep Ontarians safe. That is a comprehensive plan. That is what we are putting into action right now.
Thank you. Supplementary question.
The Premier should be moving swiftly and making urgent investments, which is not happening. Yet the Ford government seems surprised by developments, hoping to save a buck, especially in our classrooms. Nearly 200 schools now have reported cases of COVID-19. Public health experts, including the Hospital for Sick Children, have been very clear. It's impossible to safely distance in classes of more than 15. Yet the Ford government refuses to make the investments needed to safely cap class sizes, which is what needs to happen. How long will parents have to wait before the government takes the measures we know are needed now?
Minister of Education.
Well, thank you very much, Mr. Speaker. I'm proud that the government has unveiled a plan endorsed by the Chief Medical Officer of Health of this province, $200 million in investment. Speaker, let me tell you what that investment is yielding province-wide. As of this morning, over 2,044 teachers have been hired because of government investment in ensuring the safety of our schools. Over 92 mental health workers, over 1,100 custodians have been hired. An additional 372 early childhood educators, another 162 education assistants, another 551, doubling the capacity of mental health nurses within our schools. This is investment, this is leadership, and it demonstrates that we will do whatever it takes to keep our students and staff safe in the province of Ontario, Speaker.
The final supplementary.
And yet COVID-19 is expanding in our school system. Parents and families are watching Ontario slide backwards. Cases continue to grow in our schools and long-term care homes. There is a backlog of 65,000 people waiting for test results. In over half of the cases, we don't know how people got sick, and we lack the contact tracing in this province. And the Premier has spent the last week slowly rolling out one pillar at a time. Those pillars change day by day. So there is no confidence in this government's plan. Why, Mr. Speaker, with the second wave of this pandemic upon us, is this government still scrambling to chase the crisis?
Minister of Health.
Thank you. Well, I would say to the member that the plan has been in place for some time. It has already been in implementation for a long time. What we're doing is building on some of the basics that we started with testing, tracing, and isolation to make sure that we can reduce the community transmission. But specifically in terms of contact tracing, we are investing over $1 billion to expand efforts to test, trace, and isolate COVID-19 cases. And as part of this, we are going to be bringing in more than 500 new contact tracers on top of the 2,750 already in place. And we are working with Statistics Canada. They are also providing another 500 employees to help with contact tracing. So we will have 3,750 contact tracers in place to deal with the increasing cases. So we were prepared for it, and we are dealing with it.